These days, cesarean deliveries are happening more than normal deliveries. See, a child is born in two ways. First, normal delivery, and second, cesarean delivery. Delivery means the birth of a child through an operation, which is also called a C-section delivery. So today, in this video, we will learn about cesarean delivery. So let's find out through 3D animation.
In a C-section delivery, the woman is first laid on the bed, and then anesthesia is administered to the spine by the doctor, which numbs your body so you do not feel pain during the surgery. After this, the patient's abdomen is thoroughly cleaned to ensure there are no bacteria or germs on the stomach. Then the surgeon makes a horizontal incision on the patient's abdomen. The incision is approximately 10 centimeters long. This is also called a bikini cut. After the cut is made, the abdominal muscles are moved aside. Then a cut is made in the uterus. And the baby is observed and gently taken out through the same cut. After taking the baby out, the umbilical cord connected to it is also cut, after which the placenta inside the abdomen is also pulled out, and then the incision is stitched up and closed, and the stitches heal in a few weeks. Now we know why a cesarean delivery was done. Look, the first reason is if there is a problem with your pelvis, which makes it difficult to give birth to the baby during delivery. The pelvis is the bony structure near the abdomen that includes the hip bone. It connects the lower back and the legs. Another reason is if the size of your pelvis is very small, it can also be a problem for you. So, for this reason, you may need to have a cesarean delivery, and the third reason is that the baby's head is too large for the birth canal, which is also called labor dystocia, for which a cesarean delivery is necessary. The fourth reason is that the baby's heart rate is abnormal, which prevents a normal delivery, and a C-section delivery is required. After that, the baby is treated. The fifth reason is that if you are a high blood pressure and diabetic patient, then a cesarean delivery is also performed by the doctor. The sixth reason is when you have two babies in your womb. In most cases, a cesarean section is done. The seventh reason is that if you have previously given birth to a baby via cesarean, then you also have to undergo a cesarean delivery. The eighth reason is if there is any disease related to your private parts. So the baby is not delivered through normal delivery because the baby can also be infected by that disease. Hence, a C-section delivery is done. So these can also be reasons for your cesarean delivery. Now we will know how to take care after a cesarean operation. After the surgery, you will be taken to the recovery room and your health will be checked. And if the baby is born healthy, it will be kept with you in the recovery room. If there is any issue with the baby's health, the baby will be kept in a special room and monitored. It may take you 4 to 6 weeks to recover after a C-section. After going home, you need to take full care of your health because it is a major surgery. So you need to rest completely for a few days and try not to do any heavy work for the first 6 weeks and take full care of yourself and your baby. Do not lift anything heavier than the baby and avoid climbing stairs for 2 to 3 weeks. And remember to drink as much water as possible to avoid constipation and avoid intercourse for a few days after the surgery. Otherwise the stitches may open, and take care of your happiness. Do not take any kind of stress or tension. This will keep you and your baby healthy, and make sure to consume plenty of nutrients. Include green vegetables and fruits in your diet. And also remember, do not let the wound get wet. Keep it dry and clean so it can heal quickly, and do not put any pressure on your abdomen. Always take support when sitting or standing. You know what to eat after a cesarean delivery. After a cesarean delivery, your body needs protein and calcium so that your surgery stitches and muscles can become strong. For protein and calcium, consume milk, yogurt, and ghee in good amounts so you can recover quickly. The second thing is whole grains. You need to add whole grains to your diet. Whole grains have a high amount of carbs and they increase milk in your breasts, allowing the baby to drink plenty of milk. The third thing is vitamins. For vitamins, you can take oranges, papaya, watermelon, strawberries, grapes for vitamin C, and these are the best foods to eat after a C-section, and these fruits and vegetables also protect you from any infection. The fourth thing is iron. For iron, you can drink red juices like carrot juice, beetroot juice, pomegranate juice, which are rich in quantity.